So today I'm going to talk about sun damage. What is sun damage, and number one, how can we treat it? If you want to know about what UVR actually does on a cellular level, please go and visit my post on my page here, and it's called the sunburn story. So it's also on my YouTube channel and it's also on my Instagram page. So have a look at that, because I want you to understand the physiology and the mechanics of what happens when actual sunlight hits your skin. So that's the cellular aspect of it. I'm not going to go into details over here. So please have a look at that post, the sunburn story, and that's going to tell you a little bit more about what happens when UVR portion of the sunlight hits your skin. Now, aging is divided into two components. So major components are extrinsic or external aging, and intrinsic aging, which is the natural senescence. That is the natural aging process with the progression of time. So I'm going to focus on extrinsic aging or external aging, because 90% of the damage that takes place on our skin is due to enviroaging or UVR radiation. Ultraviolet radiation is responsible for 90% of the weathering process that is taking place on your skin over a prolonged period of time. So what are the signs or the clinical signs of photoaging? Photoaging means aging that is occurring due to sunlight. We have a term and we call it weathering of the skin. So weathering actually does imply what it says and means. It's weathering. So when the sunlight over a prolonged period of time hits your skin, first of all, is going to adapt slowly, but then the adaptation process is going to diminish with time, because you are going to be continuously and disproportionately be exposed to the harmful radiation of the sun. What is going to happen? The skin is going to undergo, the entire skin matrix will undergo certain physiological and cellular changes and biochemical changes that are going to alter the appearance of your skin. If you all have read my sunburn story, you'll realize that a lot is happening at a cellular level. So the most important thing that is happening is the release of free radicals. When ultraviolet radiation hits your skin, you have a huge influx and a release of free radicals. What are free radicals? Free radicals are damaging molecules. They are going to damage and degrade important structures in your skin. For instance, collagen. So now we are coming actually into the dynamics of photoaging. So now the damage has happened. You have not been very careful with your sun practices, and you are now facing with photodamaged skin. First of all, what are the hallmarks of photodamaged skin? Well, there are going to be various degrees. So you'll have mild, moderate, severe, advanced. You can have various degrees of photodamage. And that is going to range from anywhere from very fine wrinkles to very advanced wrinkles, blotchy skin, thick skin, yellow skin. It's going to have a various degree of dryness, and of course, different stages of skin cancers and skin lesions. Actinic damage. This is known as actinic or light or sun-induced damage. That is what you're going to see in photoaged skin. So how do we manage or how do we treat photoaged skin on a clinical level? We can divide it, for sake of simplicity, into 4 levels of treatment. 4 levels of treatment are going to be assessed. Your physician or your dermatologist is going to assess the degree of damage, and accordingly they will employ different modalities of treatment. They can range from primary to secondary to tertiary, and then of course you have a 4th that I've added, and that is known as Nutri Cosmetics or the beauty pill, which is a new emerging science. The primary treatment of photoaging is preventive. Actually, photoaging or external aging, extrinsic aging can be prevented. So whereas we don't have much of a say as far as the intrinsic aging is concerned, or chronological aging as it's called, but we do have control over extrinsic aging. This is so important. This is a preventative, proactive measure that you can take from very early on, especially if you have lighter skin tones. It's quite important that you do this from very early age. So from very early age, you need to photoprotect your skin. So the primary treatment of photoaged skin is preventative, and it's photoprotection, meaning sunscreen. Please read my post on the ideal sunscreen so that you can understand that what the ideal sunscreen is and how you can employ that ideal sunscreen into your daily life. An ideal sunscreen is that sunscreen that you're going to apply daily. It's not going to cause issues with your skin. You feel safe with it. It does not leave a greasy residue, no streaks, and your skin accepts it. If you are going to find that ideal sunscreen in the market, there are so many of them. Neutrogena is one such brand that I really like. Please use it, stick to it, because that is something that you're going to stick with. It's going to help you as far as compliance is concerned, and you are going to apply it happily on a daily basis, and that is the ideal sunscreen. Now that we've covered the primary arm of treating photoaged or sun-damaged skin, how about the secondary arm? Secondary arm is fascinating and very interesting because it involves cosmetics, cosmeceuticals mainly. So by using topical applications of certain targeted and focused ingredients, we actually can help the quality of your skin, and we can also manage certain signs of photoaged skin. And these cosmetics need to be focused and targeted and science-based. So what are they going to be? Top of the list are going to be the retinol, the retinoids, the retinoic acids, the retinol esters. So the retinol family of compounds are the most powerful compounds in preventing and treating photoaged skin. Next, after the retinoid compounds, we have the topical antioxidants. Of course, the number one is going to be L-ascorbic acid and certain vitamin C esters. They're very helpful. So number two is going to be antioxidants, which will include L-ascorbic acid, vitamin C, niacinamide, alpha-lipoic acid, resveratrol. Various known and scientifically proven antioxidants are actually going to help you manage the initial or the early to middle stages of photodamaged skin. So topical antioxidants is number two. Number three in the secondary arm of treating photodamaged skin, number three compounds I'm going to say are going to be moisturizers. Moisturizers containing growth factors, peptides, cytokines, ceramides. All of these are going to not only stabilize your barrier, these moisturizers are going to stabilize your barrier, form a thin film on the surface of your skin, thereby protecting it from various other kinds of pollution like aerotoxins, air pollution, smog pollution, and other external triggers and factors like smog and dust. It's going to actually be an anti-pollution measure. So moisturizers are not only important for protecting your skin, stabilizing the barrier, but they will also form a thin film, hence protecting your skin from external pollutants. Plus, they're going to prevent water loss. So with photodamaged skin, you have dry skin. This moisturizer, inclusion of a moisturizer in your skincare routine is going to prevent water loss. So cosmeceuticals, with an emphasis on serums and proven ingredients in your moisturizers, are actually going to really help you in managing the early stages of photodamaged skin and also sometimes the mild to moderate stages of photodamaged skin. Now, what if your photodamage is severe? So you are now entering into severe, moderate to severe to advanced photodamaged skin. This is when we move into the tertiary or the third arm of treating photodamaged skin, and that is going to be invasive. So that is going to involve soft tissue augmentation, Botox, fillers, IPL, lasers, chemical resurfacing, and dermabrasion, microdermabrasion. So all of these, and of course the new technologies, so PRP, mesotherapy, all of these are going to help you into managing the more advanced and severe clinical signs of photodamaged skin. So you need to go invasive now. So now you're moving away from the cosmeceuticals, you're entering into a more invasive methodology. Naturally, your physician is going to decide, and of course they will take your desires and your needs into consideration, and they may even tailor your treatment such that you have the first and the primary and the secondary and the tertiary arms all mingling together, forming a tailored approach to treating photodamaged skin. So they may also include maybe some cosmeceuticals and then take some tertiary procedures, invasive procedures, and then give you a full package whereby you can manage photodamaged skin. Then you have the fourth treatment modality that I've included, and that is something very new and emerging. We require more studies, but there is some place for it in the treatment of sun damage, and those are going to be Nutri Cosmetics. Nutri Cosmetics is the marriage of cosmeceuticals on one side and Nutri Cosmetics, that are supplements that we take to benefit our skin via food or pills. When you combine those two, you form something known as Nutri Cosmetics. These are oral cosmetics. So vitamin C, niacin, vitamin D. These are certain cosmetics that you actually can eat orally. So they're Nutri Cosmetics. You can see benefit on your skin. Some newer ones, of course, then you have the DMEA. And then you also have estrogen, so hormone replacement therapy, which you need to discuss with your physician. Estrogen, DMEA molecules, all of these are actually going to help the quality of your skin, and not to forget oral collagen. So hydrolyzed collagen taken on a regular basis has been shown to improve the moisturization of your skin and the wrinkling of your skin, along with the overall quality of your skin, the softness and other parameters. So hydrolyzed oral collagen, along with these other Nutri Cosmetics that I just mentioned, they may help you in or supplement you in treating photodamaged skin. So this is the treatment of photodamaged skin in a nutshell. So we have the primary, the secondary, the tertiary, and then we have the beauty pills. This is kind of a broad approach, and each case is going to be tailored according to the severity of the photodamaged skin. The treatment is not going to be a cookie cutter treatment. It's going to be a tailored approach whereby we assess the level of photodamage and we take these modalities into consideration to form a complete and a very evidence-based treatment method for you. Before I go, I want you to take away this message. The most important aspect of this treatment, 3+1 treatment system, is going to be what? It's going to be photoprotection. So photoprotection is going to prevent you from a long-term heartache and long-term hassles. You will not be having to deal with severe forms of prematurely aged skin. Photoprotection, both holistically and in the form of a physical sunscreen, is really going to help you. So number one is photoprotection. That's the primary. And then we are going to move into the secondary Nutri Cosmetics. And lastly, but not least, are the more invasive measures that you need to take when you have severely photodamaged skin. And do look into Nutri Cosmetics. That's an interesting emerging field that may have more of a significance when we see some more studies coming in. But then you may want to look into that as well. So take care, everybody.